How's it going? James Snapp from Snapp Therapeutics in Mesa, Arizona. Hey guys, I wanted to talk to you today about massage for children with developmental disabilities. Now this can range from autism spectrum, learning disabilities, ADD, cerebral palsy, quite a variety, fetal alcohol syndrome, to basically any sort of neurological disability where there is a developmental complication either during the prenatal life, where the baby's in the mommy's tummy, or later when the child is going through developmental processes from birth, say, to about 7 years old. So there is a process of therapy called chronologically controlled developmental therapy, CCDT, and that was developed by Ed Snapp, who was my father. And CCDT is a program that the name kind of tells you what it does. Chronological, so we use chronological sequences of sensory information to help to trigger reflex responses and neuro reprogramming in the central nervous system, the brainstem, and the spinal cord. That turns on the upper cortical functions that help to correlate the information that's going in and out of the body. So using these special environment sequences, this allows the nervous system to reprogram from a chronological situation. So chronological order. So chronologically control, we control the environment, we control the sounds that the person hears, the child or the adult. We control the temperature in the room, we control the feelings, the sensations that the person is receiving, whether it be pressure or light touch or slick surfaces or flexion. Maybe the child needs to be in flexion position. Maybe the child needs to be in extension, laying on the belly. Maybe there needs to be crawling patterns. All these things are the control mechanism. So chronologically control, you want to control the environment so that it closely matches that of the prenatal environment or a developmental sensory environment that is suitable for the developmental disability that you're working with. Chronologically controlled developmental, of course, we're dealing with the development, so everything that's chronologically controlled is based on the development. And therapy, of course, is the activity that we're doing to bring about the change in the person, the child, the adult, with the developmental disability. Now, you could say developmental disability can also be classified as an injury, neurological injury, so to the brain, to the spinal cord. So it could be anoxic, which is a loss of oxygen, or it could be toxic, which is some sort of chemical interaction or something else that's happening inside the body that's affecting the function of the nervous system. So far, what we talked about is chronologically controlled developmental therapy and dealing with the sensations and how those things work. So when you're dealing with massage therapy does a couple of things to the body. One is it reduces the sympathetic nervous system. So when the sympathetic nervous system is at high alert, everything's going wild. You've got the brain is being stimulated to cause what's called autonomic responses in the body, like the heartbeat, the breathing, and the blood pressure, the pulse, the temperature in your body, the regulation of temperature, fight or flight. So anything that is going to raise your awareness. So your endocrine system, the adrenals, the adrenal cortex, the kidneys, they produce the corticosteroids and all this stuff that spins you up into this protective response. A lot of times, children with developmental disabilities or anyone that is out of balance neurologically or developmentally or with the disease process is going to be in a heightened state of sympathetic nervous system. So one thing massage does is reduce the sympathetic, brings up the parasympathetic. And so these things are like this. So let's say sympathetic, parasympathetic. The calming state is turned way down. like you turn a thermometer or thermostat down. So the parasympathetic's way down here, not functioning. Heightened awareness, boom, way up here. Okay, so what we want to do is we want to bring this down, we want to bring this up. Now, somewhere in there you want to find this really balanced point where they're both doing what they need to be doing. So you're getting a nice flow of sympathetic, parasympathetic, balance, harmony, homeostasis is what they call it in medical. So you get a balanced homeostasis, and that can happen through massage therapy. Now, a lot of people might say, well, you know, that could be, especially doctors and specialists and this and that. You're going to say, well, massage is nice for calming you down and things like that, but it's not going to have a long-term result. I would say that that is not true, but what you have to do is you have to find someone who does understand what they're doing with the massage therapy and with these sequences and things like that that can help the nervous system heal. And that's where Snapp Therapeutics comes in. My training in the background with these chronologically controlled developmental therapy allows a person to get some pretty amazing results here. Not to toot my own horn, but I would like to say that we've seen some pretty phenomenal things happen. Changes that vary in quite a dynamic that can help a child or an adult to have a greater quality of life, improve function, improve coordination, improve mental clarity and abilities. And these things are all very important, from gross motor to fine motor changes, from coordination to functional changes, to social changes, speech, language changes, posture, muscle tone changes. You know, so often we see children with cerebral palsy who have muscle tone imbalances. So you'll see someone with this kind of thing, or with this sort of pattern, or you might just see something in the feet, or something in the eyes, even some visual dysfunctions, or changes in the way the mouth works. So there's all these things that are going on. And so with all this, you have to reintegrate. The reason that you're seeing these things isn't because there's something wrong, it's because there's actually something right with the person. What we want to find out is where are these things displaced, because these are sequences of movement that are developed. So sequences of pattern, development, movement, patterns. So the patterns of movement are in the nervous system, they're in the DNA, they're in every cell. And what we want to do here with CCDT is unlock those secret codes that are locked into our DNA. And when you do that, you get a change that's not only permanent, but it balances the nervous system, it creates correction, and it allows the person to have improved function. So why massage for developmental disabilities? For one, it reduces the parasympathetic, it reduces the sympathetic overtones of the nervous system, it increases the parasympathetic, creates homeostasis in the body. Why CCDT? Because it reprograms from a DNA level for neurological and developmental motor function. So it's very important to observe this stuff, take a look at it. You can see our website, www.snapptherapy.com, 2 P's. Please check it out, and we look forward to serving you. There is so many things that I would love to say, but I would keep these videos short and sweet, and I think that you will find it very interesting. If you look into this work, please give me a call. I'd love to share with you how we can help you or someone that you love, and what that might look like. So let's see what we can do. There's hope. That's the one thing that I was trained in to believe, is that there's always hope. A lot of times in traditional medical, they leave you kind of hopeless, with not a lot to look forward to, nowhere to really turn to. But one thing that I know for sure that my life is for is to encourage other people and to help them see that there's hope for their developmental and neurological disabilities. And I hope that you will give me a chance to work with you and spend some time at least talking. Free consultations here for chronologically controlled developmental therapy. And that's always a good way to just kind of see what we're doing here. You can see the center here at Snapp Therapeutics in Mesa, Arizona, and talk about things. So we hope to see you, we hope to talk to you. 623-755-7041. We're on YouTube, check us out. We hope you're doing great, and we look forward to serving you. Thanks a lot.